like I only had just weeks to live. I mean, I really felt like I was
Yeah,
dying.
you were pretty sick.
I was very ill. I didn't have any color in my face. I didn't have
I understand that you're willing to share some of your experiences, some of the things that have help you with your health problems. Is that correct?
any. Sure.
I appreciate it. And you have been having, do you mind sharing some of the symptoms you'd had, some of the health problems you'd had, and what you've been doing to help reverse that?
A cognition deficit, a learning deficit, memory issues. I have a real foggy left eye. I had a lot of gut pain. I had intermittent rashes coming and going, joint pains, no swelling or heat, but stabbing pains. A lot of mood swings. I had large ridges on my nails. My skin was super dry, like parched. My hair was falling out in great gobs.
You've been doing somewhat better in some of those symptoms, and
I've been doing a lot better. There's some changes that I made that I think are real simple for most people to find a way to have that change. I started drinking better water that's not conditioned with arsenic or fluoride or any additives. I started eating whole, real foods, not foods that are packaged or have an ingredient list. The IV phosphatidylcholine was huge for me in clearing up my vision and also giving me back my cognition and clarity of thought, and I believe even maybe some ambition. I started walking. That's a big difference. Lately I haven't been due to weather issues, and I've noticed the difference in the decline. I've started some supplements. I think the berberine supplement has really helped a lot to heal my gut. The adrenal complex has given me energy, and that's been nice to have the energy and this desire to meet the energy at the same time. Finding the P5P, which is a B vitamin, just processed differently, I think, huge for me.
That's helped.
In my attitude, it's almost like it makes me like happy.
And so there's times that you haven't taken it and you notice the difference.
Oh, I really noticed the difference.
Yeah.
People around me noticed the difference. I had a friend that told me 15 years she's known me, she's never known me to be giddy. And she wanted to know what I had started taking, and the only change I'd made at that point was the P5P.
I've especially enjoyed working with you because I've learned from you. You're quite well read, and one thing I learned from you was about injectable phosphatidylcholine into the xanthelasmas or xanthomas.
Yeah.
And there was a person just came to our clinic a couple days ago, and I was so excited to offer that to him.
Good.
Had very, very bright, white xanthomas or xanthelasmas, medial to the eyes. It's a cholesterol thing. Can you just talk a little bit about that? How you read about it and what we did? Yeah.
So I went to study to see what this phosphatidylcholine was, which it took me 8 weeks to learn how to say that word. So then I went to studying about it just to see what the medical literature had to say and what other studies might have been done, and bumped into a couple of papers about how they were being used for xanthelasmas, which are these ugly little eye bumps, and also by bodybuilders. They use them for, they work so hard to sculpt their bodies, and they eat well and they exercise a lot, that they just get a little troublesome area. and they use the phosphatidylcholine to inject those areas, and it takes about 6 weeks for the phosphatidylcholine to eat through that cholesterol and reduce that body image area that they have difficulties with.
Oh wow, so they use it for sculpting.
Yes, and then
Wow.
other countries are using them on these xanthelasmas in replacement of cosmetic surgery,
Uh,
because they're really not very attractive things.
yeah, he had talked to a dermatologist or plastic surgeon, I don't know which, who said he was happy to remove them surgically. But this yours have reduced in size and in brightness.
Oh,
They're
absolutely.
much closer to skin color, normal skin color.
Yeah, absolutely.
Yeah.
Absolutely.
I appreciate you sharing that with me.
Yeah, yeah.
That's neat. And so you also had some sleep apnea, and the wearing the CPAP, getting that tested and wearing the CPAP has helped.
Oh, yeah. Absolutely.
Yeah.
Well, because I was choking awake an
Yeah.
awful lot in the evening. I didn't know that that was why I was awakening. You know, I started about 60 apnea, hypopnea episodes in an hour in an evening, each hour of the evening, and down to sometimes I don't even have any. And
That's
most of the times I'm 1 and below now,
Yeah.
which is better than most people who have never had a sleep study or don't have any apnea issues at all.
Yeah.
October 13th is when I started last year. But when I came in, I felt like I only had just weeks to live. I mean, I really felt like I was dying.
You were pretty sick.
I was very ill. I didn't have any color in my face. I didn't have any desire. Well, I had desire to live, but my body was ready to just say that we're done.
Yeah.
You know, but I didn't want to die, so I came in and expressed that I've got these problems, and all of my problems have the same underlying current, and that undercurrent is inflammation. And so we got to looking and, you know, did some tests, and
You doing most all of it.
I
with
have
a little
put
bit of help.
forth a lot of effort with
Yeah.
some guidance. I did need the guidance because I wouldn't have been able to.
Yeah.
I couldn't foster myself through it because, well, I was in the position that I was in. I
Yeah.
couldn't even think properly, and still I have some issues with that. But, you know, it's getting better.
Yeah. And it's also been helpful to have help from Leah Strike, Laurel Santiago, the nutritionist,
Absolutely.
and they have added their special expertise. And in fact, most of your care has been with them. And,
Yeah.
And I have a little bit of input here and there.
Mm-hmm.
Well, thank you, Nancy, for
No, it's a great
sharing
team. You have a great team.
Yeah, we appreciate everything we've learned from you too.
Yeah. Thank
Okay.
you.